Hi there, my name is Rhonda, and I am here to welcome you to a tour of Wichita State University School of Nursing. We are in Ahlberg Hall. Sorry you can't be here to take a tour in person, but we're super excited that we can at least show you around our building and talk to you a little bit about our programs. Before we actually get started on the tour, I want to introduce the leadership team of the School of Nursing. And this is our nursing office. We're on the 5th floor of our building. And the first person that I would like to introduce is Dr. Vansella McCleary-Jones. She is the chair of our program, which is the head of the program. And her office is in here. Dr. Jones?
Well, hello. Hello and welcome. So it's my pleasure to welcome you to the School of Nursing. I'm just so pleased that you decided to get your degree here at Wichita State. We have a program that produces the second largest number of RNs in the state of Kansas, and our graduates consistently score at or above the national average on the national licensure exam for registered nurses. So we have some local partners here who welcome our students to all of their clinical rotations, and they also welcome them to employment opportunities once they graduate. And so we're just very pleased with the quality of faculty that we have here, and staff and the students that enter our program are being well prepared for their careers as professional registered nurses. You'll learn more about what we have to offer here in the School of Nursing during the tour, particularly our high fidelity simulation mannequins in the practice lab. Welcome. It's a great day to be a shocker.
Thank you, Dr. Jones. We appreciate you taking a few minutes to visit with us. The next member of our administrative team is Dr. Nicole Delamont. She is the director of our graduate programs.
Hi, I'm Dr. Delamont, and in addition to our amazing BSN programs, we have several graduate programs here at the Wichita State School of Nursing. So we actually have 2 MSN programs, one which is focused on education, and one which is actually focused on clinical leadership. In addition to our master's programs, we have several doctoral programs to prepare nurses to become nurse practitioners. And one of our programs helps nurses who have a bachelor's degree become a nurse practitioner. And the second program is actually a postmaster's NP program, or nurse practitioner program, where people who have already prepared to become a nurse practitioner go along to obtain their doctoral degree. So lots of different pathways to become family nurse practitioners, psychiatric nurse practitioners, and acute geriatric and adult nurse practitioners within our programs.
Thank you, Dr. Delamont. We appreciate you taking the time to visit with us. Our next member of the leadership team is Miss Brandy Jackson. She is the director of the undergraduate programs here at Wichita State. Mrs. Brandy.
Hi everybody, so glad you could take a few minutes out of your very busy day to learn about Wichita State. I'm Brandy Jackson. I'm the director of the undergraduate nursing programs. And I know you're really probably in a place to find your nursing program as you look at all of these colleges. So thank you for checking out Wichita State. We are the second largest nursing program in the state of Kansas. We have a lot to offer, and you're going to learn a lot about our programs today as you tour our building. You're going to get to see some really cool stuff. You're going to get to see our simulation lab and our applied learning center, where our students spend a lot of time practicing before they get to go out and work on patients. We have very strong partnerships with the big hospitals here in town, along with multiple other clinical sites across the state of Kansas, so you're going to get a really robust learning opportunity here at Wichita State. Standing right next to me is our very first uniform that our students in 1973 wore. Of course, today it's very, very different and we wear scrubs, but this is what our first nursing student looked like, 1973. So we have been around a long time and we're very proud of that tradition. So you get to learn about Wichita State today, and I hope you choose us, and have a wonderful, wonderful day.
Thanks, Brandy, for taking a few minutes to visit with us. The next stop we're going to make is on the 4th floor of this building, and that is where our advising office is at. Hey there, so here we are on the 4th floor of Ahlberg Hall. Our dean's office is down here, and then our advising office. This is the office where you learn what classes you need to take in order to get through, get to the nursing program and then finish it out. So you're going to visit for a minute with Julie Holmes. She is one of the advisors in the office.
Hi, welcome to the College of Health Professions Advising Office. I'm Julie Holmes. I'm one of 5 advisors here in the office. Some of the things that we do are to advise current students, prospective students, and as well as transfer students. First-year students right out of high school will advise their first year through our one-stop centrally located office and then come advise in our office. Transfer students, if you're thinking of coming to WSU, we're happy to look at your current coursework and see if you're on track with the prerequisites. And current students, we help with degree planning, their long-term goal plans, helping them achieve that degree that they're striving for. Our goal is for students to be successful in whatever their pursuits are. We are currently doing all of our appointments remotely through primarily Zoom, but we are happy to talk to you, and all of our contact information can be found on our website at www.wichita.edu/CHP advising. Have a great day. Thank you.
Thanks, Julie, for going over advising for us. It's a lot to work on. Our next stop is going to be down on 3rd floor, and that's where our accelerated program students spend most of their time. All right, we're now on the 3rd floor of Ahlberg Hall, and I'm going to turn the tour over to 2 nursing students. This is Jack and Max.
Hey, Future Shockers. So this is the 3rd floor of Ahlberg Hall, and this is where the accelerated nursing program is. So this classroom, they're going to spend a lot of time in it. The accelerated program is only 13 months as compared to 4 semesters for the traditional program. So they're going to be in class 5 days a week for more hours, but they do spend a lot of time in this room.
And this room is more modern than a lot of our rooms, probably the most modern room in this entire building. Each desk has its own charging block, which is pretty cool. And then back here we've got lockers for the students, as well as some collaborative workspace right here. And there is even a kitchenette to the left here for students. And next we're going to go ahead and go downstairs to the 2nd floor, where all of our programs spend a lot of their time in the simulation lab.
Alright, so this is the Applied Learning Center. Inside there you're going to find your simulation lab. So throughout the program you're going to go through what's called simulation, and it's a collaborative experience where you're paired up with some of your fellow classmates and you go through a certain situation on one of our mannequins that are pretty high tech. And it's a really great learning environment. It's super fun, and the message there is just it's okay to make mistakes there. It's preparing you to go out into the clinical world. And I've always really enjoyed my simulation experiences. So we're going to go inside and take a look.
Okie dokie. So, this is usually where we store our backpacks. And then in here is our simulation lab. And here we have Doreen, one of our instructors, as well as Gentry and Hannah, some of our 2nd semester students, who are going to be doing a practice simulation for you guys to see, so you can get an example of some of our equipment and everything. So they'll go ahead and explain a little bit further.
Hi, I'm Doreen Owen, and you've got Gentry and Hannah, with us, and they're 2nd semester students. I'm going to just briefly show you the simulation lab. So we do simulation with mannequins of different kinds, and it's kind of what you would expect for a nurse to be doing in a hospital setting. There's been studies out there that show simulation is just as effective as doing a clinical rotation in a hospital. So we're using our sim lab for about 10% of our clinical rotations. So we can actually do a delivery on a mom. This is Victoria, and she delivered a little baby. and we can do an assessment, postpartum assessment, so after a mom's had a baby, on Victoria, and a newborn assessment on the baby. We also have a pediatric patient over here. His name is Jamie today, and Gentry's going to be taking care of Jamie.
Knock, knock. Hi, Jamie. I'm your Wichita State Nursing student. My name is Gentry. How are you feeling?
It hurts to breathe.
Okay, I'm going to listen to your lung sounds real quick.
And you can make the pediatric patient have abnormal lung sounds, abnormal heart sounds, and you can interact with them. So it's very helpful as a student to get this experience in a simulation environment. All right, so next we have, over here, we have our adult patient. We call him Hal affectionately, and today he is Hal E. Wood, and Hannah's going to be taking care of him. And as you can see, you can do total assessments on these patients.
Yes. Hi, Hal. My name is Hannah. I'm a Wichita State Nursing student. I'm going to be taking care of you today. Your blood pressure was a little high, so I'm going to recheck it now, okay?
I don't feel too
You
well.
don't feel too well? Well, let's see if that blood pressure is still high.
Thank you.
So we can actually do a full head-to-toe assessment on Hal. They can check his reflexes in his eyes, pupil dilation and what have you. They can get a blood pressure on him. They can do a head-to-toe assessment on him. And then I'm going to show you where we videotape and do all of our camera things on these mannequins. Okay, thank you, ladies. So we've just got new installed cameras that we can actually watch our students doing their skills. And as you can see over here, we've got Max and Jackie, and they're watching the students take care of the patient on the screen, and we can record it, we can talk to the students. We can also play back the video so that patients, or the students, excuse me, learn more about the good things they did and the things they need to do better. And as you can see, Max is like practicing rotating the cameras. And you can get up close and personal, like if a student's starting an IV or doing an assessment, you can get like right up to where that spot is. So it's been very helpful so far. We just got this last semester. Thank you, guys. All right, lastly, I want to show you our fundamentals lab. And it's right next door. And basically, it is full of beds that we can put different types of simulations. So, for instance, if a student is learning about how to do a dressing change, we can put a model up here with all the dressing change things. If they're learning basic vital signs, this mannequin here, they can learn just basic things like doing pulses of different kinds, blood pressure, just basic vital signs. And they can learn how to do those appropriately. They also can learn how to withdraw meds from a Pyxis machine, which is actually a machine that holds medications that nurses will see on the units that they're at the hospitals. And Hannah can withdraw meds from that and to give to the patient. And they also will do practice patients in here. We'll have standardized patients is what they're called. They're actual people that pretend to be a patient, and our students can do a head-to-toe assessment on them, and we'll have them in here. And that's usually at their final exam. But it's pretty cool. And that's it. We have a good time in here, and students sure learn a lot.
Now we're going to head downstairs to the first floor to look at more classroom and lab spaces. This is the Shocks Care Lounge. It's a study space that is open as long as Ahlberg Hall is open. You can always find a bunch of stressed out nursing students doing their homework in here. And it's really awesome because there is a bigger area if you have a large group project. There's tons of couches, and then there's 4 individual study rooms that you can go into. You don't have to check them out, rent them out. They're just always here. If it's open, then you can go in there. And then we have a kitchenette on the other side of this lounge. So if you're on campus all day for lecture classes, you can drop off your lunch and then just come in here and study in between classes. We have a fridge and a microwave. So whatever you want to cook up in here, it's all yours. And now we're going to go to the lab. So we have another lab space on this floor. Our first semester of the nursing program, you take a class called Health Assessment. And throughout this course, you take it week by week. You learn about different systems of the body and how to assess them on patients. But throughout this lab, you actually get to practice everything on each other, on your lab classmates. So those lab groups will get really, really close just because you spend a lot of time together. And you pretty much have to assess each other from head to toe. And this is that lab space. So it's similar to our upstairs lab, but we have different beds and just different equipment that you can familiarize yourself with before going out into the clinical world. And now Jack's going to take us by the cadaver lab.
Yep. If you just follow me this way. So right over here, what I thought was personally a cool aspect of this university is that we do have a cadaver lab on campus. It's right here. We won't go inside today, but it's an awesome experience. Second semester, we usually do a visit to the cadaver lab, and the gal who runs it is just so passionate about it, and she's just wonderful. And so you'll learn a lot if you get a day in the cadaver lab, which I think is real cool. And then if you want to follow me this way, we're going to go ahead and go to the computer lab next. And you'll take a lot of exams in the computer lab every semester, so it's just right through here. And so there's individual desks over here, but the main place you'll be taking a lot of exams is right in here with the whole class. Right now with social distancing, we've got it spread out, so usually half the class will take it in the classroom and half the class will take it in here. But other than COVID, we usually have everyone take it in here. And then, speaking of the other classroom, I will take you there next. So if you just want to follow me this way. You'll be spending a lot of time down, and this is the base level, or basically the basement, first level. And pretty much every semester you'll have a lecture class in this classroom, so it kind of becomes home a little bit. So it's at least bright and airy in here, even though we are in the basement. But this is really just kind of becomes a comfort zone just because you spend so much time down here in the traditional program. So, and then next we can go up to the main lobby and show you around some like little study spots that Max and I utilize a lot.
Here we are in the main lobby of Ahlberg Hall. It's on the second floor. It's a really popular place for people to study, come in between classes. You get lots of natural light in, so it's kind of a happy place to come in between tests. And I really like it because you get to meet a lot of people that might not necessarily be in your program. So you get to talk with a lot of people who are further along in this program, or maybe just starting out. And then you can also meet people who are in other departments within the College of Health Professions, which is nice because we're going to be working with these people later on in our career, so it's kind of nice to make those connections.
All right, guys, we've taken you from the top floor all the way down to the basement of Ahlberg Hall, where the School of Nursing is. We thank you so much for taking a few minutes to learn a little bit about our program. And I think that concludes our tour for today.
Good job.